All right, guys, welcome back to Underground Science. In this video, we'll be talking about Factor V Leiden. Okay, so let's go and get started. So before we start talking about Factor V Leiden, we have to talk about first, right, what Factor V even is. Remember, Factor V is a cofactor for Factor 10, and they both work together to convert prothrombin, which is inactivated Factor 2, right, to thrombin. And then thrombin, we know, converts fibrinogen into fibrin so that we can form stable platelet plugs or stable clots, right? So that's what factor V is. So that means factor V is a procoagulant, right? It stimulates the formation of clots because more factor V you have, the more activation of factor 10, the more formation of thrombin, the more formation of fibrin, which means more fibrin clots. Okay, so we know that. So then, what's factor V Leiden? Well, factor V Leiden, right, is a point mutation in the factor V gene. Okay, so usually, remember, we have our endothelial lining, okay? And if I just draw one big endothelial cell like this, on our endothelial cell, we have a protein, okay, called thrombomodulin. On thrombomodulin, when thrombin binds here, so factor 2, right, activated factor 2, the function of thrombin changes when it binds onto thrombomodulin. And how does it change, right? So when thrombin binds to thrombomodulin, thrombin will then stimulate protein C and S, right? But if we're talking about protein C specifically, because remember protein S is a cofactor. So if we just draw protein S like this attached, right, is a cofactor to protein C. But thrombin, right, stimulates protein C. Then protein C inhibits factors 5 and factor 8. So that means protein C is an anticoagulant, right? Because it's inhibiting pro-thrombotic clotting factors, right? It's inhibiting clotting factors. Protein C is. In factor V Leiden, you get a mutation in the factor V gene, right? And this mutation occurs at that exact site where normally, right, activated protein C cleaves factor V to inactivate it. So, for example, if we drew factor V like this, right, and let's say this area, right, was the area where protein C, let's say looks like this, binds and cleaves to inactivate factor V. In factor V Leiden, let's say what happens is we know we get a mutation in the factor V gene where now let's say you get a change, okay, in this area where factor V binds. Okay, so remember, this is protein C, and this is factor V. Okay, in sorry, switch it up, right? Let's say we're gonna say this is factor V in this example, and this is protein C. Usually, protein C binds to factor V and inactivates it. But when in factor V Leiden, we get a mutation in the factor V gene where the area now where protein C usually binds, right, changes. So now protein C cannot bind to factor V and cannot inactivate it. So in factor V Leiden, you cannot, due to the mutation in the factor V gene, protein C is unable to inhibit factor V. Okay, so that means factor V Leiden leads to increased clot formation because more factor V you have, the more activation of the common pathway you have, the more fibrin formation you have, and the more fibrin clots you can form. Now, what types of clots are you at increased risk of forming, right? You're going to be at an increased risk of forming venous clots, okay? So like deep vein thrombosis, for example. okay, or clots in your cerebral veins, or clots in your hepatic veins, or clots in your blood vessels that supply your placenta, right, which can lead to miscarriages, okay? So that's what happens in factor V Leiden, all right? So remember, in factor V Leiden, factor V, right, can no longer be inhibited by protein C because the site where protein C normally cleaves factor V to inactivate it is mutated. So protein C cannot bind to factor V anymore. So factor V cannot be inhibited by protein C anymore. So you have more circulating levels of factor V, which means more thrombin formation, more fibrin formation, more clots, so hypercoagulability. All right. So you can see things like recurrent deep vein thromboses, pulmonary embolisms, right? You can see thrombosis in your cerebral veins, mesenteric veins, and so on. Okay, so let's go and talk about the findings. So you're gonna have increased formation of clots in your veins, so it's gonna increase your risk of DVTs. If this clot breaks off, goes to your right side of your heart, right? Your right side of your heart, and then from your right ventricle, right? It goes to your pulmonary vasculature, then you can expect an increased risk of pulmonary embolism, right? And we can also get clots forming in your mesenteric veins, which is the veins that drain your intestines, which can be bad, right? Because that's also a way you can get ischemic damage to your intestinal cells. You can get clots forming in your cerebral veins. Okay, so that can increase your overall intracranial pressure, which can be dangerous. And then, of course, you can also get clots in other blood vessels like that, or like blood vessels that supply your placenta. Okay, that's even a possibility too, which is why you see an increased risk of miscarriages in um, patients that have factor V Leiden. All right. So if we're just talking about a specific lab value, right, like PT and PTT, okay, we're not depleting PT and PTT, so you won't see an elevated PT and PTT, so that would be normal. Okay, and if you looked at bleeding time, right, you're not affecting platelets here, so your bleeding time will be normal. And in terms of like increased bleeding risk, right, you're not consuming clotting factors. You're not consuming clotting factors, right? Meaning you're not cleaving it and destroying it. So your bleeding risk will also be normal, okay? And the reason why, or not normal, you won't have an increased bleeding risk because you're not this is a prothrombotic disorder, okay? You're forming clots, not it's not a thrombotic disorder where you're like cleaving a bunch of clotting factors like we see in increased plasmin levels in the blood. So remember, right, your PT and PTT would be normal because you're not consuming, you don't have a deficiency in clotting factors. Okay, because remember, you do this PT and PTT test, right? Like, what is this measuring? It's measuring if you can clot properly, right? Like how long it takes you to clot. So when you're doing these tests, it's done in a test tube. Okay, so in the test tube, you're purely measuring the function of your clotting factors. And in factor V Leiden, factor V is working perfectly fine, right? So you're doing the coagulation cascade, especially the common pathways occurring normally. So your PT and PTT would be normal, right? When you're measuring the PT and PTT in a test tube, okay, it's not, you don't have the involvement of protein C. Okay, so that's why that's why PT and PTT would be normal because in the test tube, right, factor V is working perfectly fine. There's no interaction between, protein C and factor V and protein C not being able to inactivate factor V and so on. Okay, so PT, PTT is perfectly normal. And then just remember that factor V Leiden is a you're going to be in a hypercoagulable state. Okay, so so yeah, that's basically it. That's factor V Leiden. Um, Hopefully this video made a little bit of sense. Hopefully you guys learned a little bit. Thank you guys for watching and see you guys in my future videos.